Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Kindly like, subscribe, and share. Your hands are incredible tools, capable of everything from delicate movements like threading a needle to powerful actions like lifting heavy objects. Every day, we rely on our hands for countless tasks, often without even thinking about the complex structures that make all this possible. But have you ever wondered what gives them their unique shape, remarkable flexibility, and impressive strength? The answer lies deep within, in the bones that form the framework of your hand. Beneath the skin are 5 long bones called metacarpals. These bones form the bridge between your wrist and your fingers, acting as the sturdy foundation for all hand movements. Without them, your hand wouldn't have its familiar shape or function. Each metacarpal lines up perfectly with a finger or your thumb, connecting the wrist bones, known as carpals, to the finger bones, called phalanges. This alignment allows for the precise coordination needed for everything from typing to playing musical instruments. You can actually feel your metacarpals on the back of your hand, running in straight lines from your wrist all the way to your knuckles. Try pressing gently, and you'll notice the firm ridges beneath your skin. When you make a fist, those prominent knuckle bumps you see are the rounded heads of your metacarpals pushing up against the skin. They're what give your fist its shape and strength. These bones are essential for gripping, spreading your fingers wide, and nearly every movement your hand can perform. Whether you're catching a ball, writing a note, or simply waving hello, your metacarpals are hard at work. Because they're long and relatively thin, metacarpals are prone to fractures, especially the 5th metacarpal, near your little finger. This injury is so common it's often called a boxer's fracture, and it can happen from something as simple as punching a hard surface or falling on your hand. A break in one of these bones can make even the simplest tasks, like buttoning a shirt or holding a cup, painful and difficult. It's a reminder of just how much we depend on our hands every day. Understanding these remarkable bones is the first step to knowing how hand injuries happen, how they affect your daily life, and how the healing process works. The more you know about your metacarpals, the better you can protect and care for your hands. How do metacarpals break? These long bones in your hand are surprisingly vulnerable, even though they're built to withstand daily use. Understanding how they break can help you recognize the risks and act quickly if you're ever injured. Most often, it's from a direct impact, like punching a hard object or falling onto your hand. Even a simple trip and fall can put enough force on your hand to cause a fracture, especially if you instinctively reach out to break your fall. Sports injuries, accidents, or even slamming your hand in a door can all cause fractures. High-contact sports like basketball or football are common culprits, but everyday mishaps can be just as dangerous. When a metacarpal breaks, pain is immediate and sharp, especially when you try to move your hand. The discomfort can be intense, making even small movements difficult. Swelling quickly follows, making your hand look puffy. This swelling is your body's natural response to injury, and it can make your hand feel tight or stiff. Bruising is common, and the skin may turn blue or purple. Sometimes the discoloration spreads over several days, making the injury look worse before it gets better. Sometimes your hand or finger looks deformed. A knuckle may seem sunken or out of place. This visible change is a strong sign that a bone has shifted or broken. Numbness or tingling can occur if nerves are affected. You might also notice a pins and needles sensation, which can be alarming and uncomfortable. Gripping objects becomes nearly impossible due to pain and weakness. Everyday tasks, like holding a cup or turning a doorknob, suddenly feel out of reach. These signs are your body's way of saying something's wrong. Ignoring them can lead to complications or longer recovery times. If you notice them, it's time to get checked out. Early treatment can make a big difference in how well your hand heals and how quickly you get back to normal. Suspect a broken hand? See a doctor right away. The doctor will ask how the injury happened and examine your hand for swelling, bruising, or deformity. They'll check your ability to move your fingers and make sure nerves and blood flow are okay. The real confirmation comes from an X-ray, which shows exactly where and how the bone is broken. X-rays reveal if the fracture is simple or complex, and whether the bone pieces are lined up or displaced. This information is crucial for choosing the right treatment. Quick diagnosis means a better chance for full recovery. Once a metacarpal fracture is confirmed, the main goal of treatment is to realign and stabilize the broken bone, ensuring it heals in the correct position. The specific approach depends on the type and severity of the fracture, as well as the patient's overall health and activity level. Most simple, non-displaced fractures are treated with a cast or splint to keep the bone still while it heals. Immobilization helps prevent further injury and allows the bone to mend naturally over several weeks. During this time, regular checkups are important to monitor healing progress. If the bone is out of place or misaligned, the doctor may need to gently realign it, a process called reduction, before immobilizing your hand. This can often be done in the clinic using local anesthesia to minimize discomfort. More severe or unstable fractures, such as those where the bone is shattered, the joint is involved, or the fracture cannot be held in place with a cast, may require surgery. Surgical intervention is also considered if there are multiple fractures or if the bone has pierced the skin. During surgery, surgeons use specialized hardware like plates, screws, or pins to hold the bone fragments together securely. This internal fixation helps maintain alignment and stability during the healing process. After surgery or a successful reduction, your hand is protected in a cast or splint for several weeks to support healing. Follow-up appointments are essential to ensure the bone is healing properly and to address any complications early. Rehabilitation is a key part of recovery. Physical therapy helps restore strength, flexibility, and function to your hand, while also preventing stiffness and long-term problems. With proper treatment and care, most people can expect a smooth recovery and a return to normal activities, setting the stage for a healthy, functional hand. Healing begins as soon as your hand is immobilized. Your body builds new bone, but recovery takes weeks. Keep your cast dry, elevate your hand, and gently move your fingers to prevent stiffness. Once the cast comes off, your hand may feel weak and stiff. This is normal. Physical therapy helps restore movement and strength. Most fractures heal well, but complications like malunion, crooked healing, non-union, failure to heal, or infection can occur. Rarely, chronic pain or arthritis may develop. Early, proper treatment reduces these risks. If you suspect a fracture, don't wait. See a doctor promptly. With care, your hands can return to all the things you love to do. UMCC, your ultimate medical consultant connectors.